Now, welcome back. Now, the Namibian Surgical Society, in conjunction with the Ministry of Health and Social Services, are hosting the 22nd edition of COSECSA AGM, graduation, as well as the annual scientific conference in Windhoek this year from the 7th to the 9th of December. Now, the graduation ceremony will see over 150 graduates receive their specialization degree at the Safari Court and Conference Center. Now, joining us with more detail this morning is Dr. Akutu Munyika, who is the Secretary of the Namibian Surgical Society, as well as Professor Filemon Amaambo, the President of the Namibian Surgical Society. Good morning, gentlemen, and welcome.
Thank you. Good morning, Lot.
Okay. Now, it is quite interesting. I expect maybe there will be also a female. You know, they say future is female, eh? Huh?
They are actually quite busy with the events,
okay.
But they are there.
Okay. Now, maybe before we get our conversation right off, let's talk about what is the Namibian Surgical Society? What are its roles? What are its functions?
So the Namibian Surgical Society is a non-profit organization which is representing the surgical specialties in Namibia. It was started in 2016. It's working in conjunction with the Ministry of Health, the University of Namibia School of Medicine. And the aims and objective is really to streamline and to assist in the training of the candidates who are specializing in surgical disciplines. So it's general surgery, orthopedics, and urology at this moment. There are others that will follow. So, it's been a journey since 2016 to try and solidify these activities. So far, we have some candidates who have already graduated, and we have some who are in the process of training. The idea is to train within the country, because when we go outside and train outside, we take the human resources outside, and we have the need here in the country. So this is the whole aim of the Namibian Surgical Society with its stakeholders.
Okay. Now, Professor, perhaps from a point of view being president, I'm assuming, if I'm correct, that you have been the president since inception. What has been your overview since 2016?
Well, the overview is that we at least have started to address some of the issues that have been keeping us down for so long. We have not yet finished the process, but definitely we have started, and we hopefully will be expecting to be supported so that we can become even more stronger, because in the end we would like to see to it that surgical services and possibly other services are delivered equitably throughout the country, and not to carry on with the system that is only partially successful. There is room for improvement. Yes.
So we're looking at equity and obviously spreading this kind of skills around the country, instead of people coming from Rundu, coming from Umsati or Hangwena, Maeke, just to come to Windhoek to get those services.
That is implied. Yes.
Oh, okay. Now let's talk about the fact that you're having the Namibia became part of the COSECSA Africa member countries in 2016. Let's talk about some of the benefits of this, and what is this organization?
Right. So COSECSA is the College of Surgeons of East, Central, and Southern Africa. And it's a college without borders. So we became a member country in 2016 when we made an application. There are three main colleges in Africa which are training surgical specialties. One is what we know, the South African College of Surgeons. There is a West African College, which is up in the West, and then COSECSA, which is this college that we are affiliated to. Now, the benefit is that this college draws experience from all over the world. We are talking about reputable institutions like the College of American Surgeons, the colleges in the islands, in the UK, in Australia, and these are all reputable institutions which are supporting this college. So we benefit from this knowledge that is coming from all over the world. And as we speak now, we have all these reputable colleges which have flocked into Windhoek for these events. So the benefit is that we are actually rubbing shoulders with the who's and who's of the surgery, the people who have written textbooks that we are using in our medical schools. So this is the whole benefit that we are looking at the moment.
Okay. Now, Prof, let's talk the fact that the Surgical Society has accredited 4 hospitals in the country. Talk to us about this surgical process that these hospitals provide and what accreditation actually entails.
Well, let me start with explanation of what accreditation entails.
Please.
You see, it's a process. The college will send or sends representatives to these hospitals and look at what is on the ground. And then they evaluate that particular hospital if it is at the standard that can be accepted for training specialists. Right now, when the College of East, Central and Southern Africa came to inspect our hospitals, it accredited 4 hospitals. They look at the work that is being done, the volume, the specialists who are there, the facilities, the equipment, and the patient loads, and then they write a report. Now, the hospitals in Windhoek, following that accreditation process, were then accredited. That is now Windhoek Central and Katutura together. They can train in general surgery, in orthopedics, and urology. Oshakati Hospital can train in general surgery and orthopedics. Onanjokwe Hospital can train in general surgery. Now, that is a starting point.
Okay.
It is quite possible that if there will be another accreditation process, it's quite possible that perhaps some other specialities may be added on the list. So there is another benefit for this. That is, we train people not as individuals, but this process is also assisting our facilities to elevate the standard of care. You see, when you are trained outside as a specialist, when you come to your country, you often discover that your country is not ready for you. You start demanding things which people don't know about. You start with working with colleagues who don't know or who are not prepared for the process. Now, we want to overcome all these obstacles. Okay, so that was the first part. I think, yeah, I explained. I hopefully responded to the 2 questions.
Yeah, no, you did, Dr. But just maybe perhaps as a follow-up question to that is the fact that all the 4 hospitals that you've identified, these are basically state hospitals. So that could mean that perhaps maybe there is something that the Ministry of Health is doing right.
Yes.
Oh, yes, definitely. So you see 80 to 85% of the population probably depends on the state facilities. And that is where the greatest need is. And this is, you know, the private sector is well covered in terms of services. The great need is on the state side. So the ministry is supporting these ideas and these projects so that we can address the challenges that are facing the state facility. So this is why the colleges and this kind of training are more focused. But the private sector is also involved, because if you look at Onanjokwe, for example, Ondangwa Private Hospital is working together with Onanjokwe Hospital, because sometimes there are some facilities which are not available at the state, which are available at the private. So there's this joint venture between the state and the private. If you look at Ongwediva and Oshakati, it's the same thing. It's the same thing that is happening in the coast. The private sector is working together with the state. So this is very important that we streamline and we use all the resources together to reach the goals and objectives.
Okay. No, thank you for that. Now, let's talk about the fact that the society will be, and other stakeholders will be hosting the COSECSA AGM under the theme Timely Response to Current and Emerging Surgical Services on the Continent. Talk to us about this.
So this theme was specifically chosen this time because of the current wave of challenges that are facing the health sector in general. We just emerging now out of the COVID situation, which has really challenged us and stretched us to a limit. So this is one of the challenges that has faced us. During the COVID pandemic at its peak, there were disruptions of surgical services. We all of a sudden had to focus more on the physical well-being and the COVID situation of our patients. The lists for surgery have been cancelled, put on hold, and this is a specific challenge that has faced us during this time. So there are many other challenges that we are preparing for. We don't know what's happening to the weather, the environment, all these environmental factors, and those are all things that we are going to be talking about. Now, there will be a lot of presentations looking at these challenges and how, as a surgical fraternity, are going to be dealing with them and to find solutions. And this is going to be mainly focused on the last 2 days of the conference, which is Thursday and Friday this week at Safari.
Okay. Are you able, perhaps, maybe Prof or Dr. Munyika, maybe able to take us through the program? Who are some of the keynote speakers and participants that will take part in the program?
So these events started already end of last week with some workshops. This coming today actually and tomorrow there is examinations of these candidates who are training, and not only those who are from Namibia but from the 14 African countries. They have all come into Windhoek. So, and on Wednesday we have the graduation ceremony which is going to be graced by the Vice President, His Excellency Dr. Nangolo Mbumba. It's going to be at Safari. And then on Thursday and Friday is the scientific conference, and different presenters coming from all over the world, including those who are coming from Namibia, are going to present scientific papers during this. And it's very encouraging to have this wealth of knowledge in Windhoek, and we are encouraging all the health professionals and the physicians not to miss this opportunity. So that, in a nutshell, is the program for this week.
Okay. Now, before we get to wrap up our conversation, unfortunately, we are running out of time. Doctor, is perhaps maybe any contribution that you would like to add, and specifically maybe with regards to the graduation and the scientific conference? What does this mean for Namibia, especially from a knowledge management point of view?
Well, let me put it this way. We as a country have to start realizing that it's not correct to assume that we have got nothing. We have got resources which we should be utilizing effectively. So hopefully this graduation, some of the people who are writing these examinations are from this country, are in Namibia now. It should give us confidence. It should motivate us to work even harder. So, and then for those who don't know what COSECSA is all about, hopefully they are now giving the opportunity to see with their own eyes and to experience what is actually happening, and not to end up, being told stories. It's a real thing. Now, I want to add one more thing, and that is on the challenges. One of the challenges we hopefully would like to continue addressing is the challenge of equipment. The equipment we use when we are carrying out operations, they are manufactured elsewhere. And we are acquiring them at a high cost. So the time it's an emerging challenge that we have to start contributing to the manufacturing of equipment as well, starting small, so that at least we can save some funds. Otherwise, we are buying equipment at a dictated price by the manufacturer. Those are the challenges. But we can't do these things if we don't get involved.
Yes. No, thank you very much. Unfortunately, we are out of time. And we hope that we can continue this conversation the other time. But we wish you all the best of success.
Thank you so much, Lord.
Oh, okay. Yeah. Now, that was Dr. Akutu Munyika, the Secretary of Namibian Surgical Society, as well as Professor Filemon Amaambo, who is the president of the same society, talking to us about the COSECSA AGM graduation and annual scientific conference that is currently taking place in Windhoek and will conclude between the 7th to the 9th of December 2022. Now, do stay tuned. Good, maybe I get to return shortly with another interview.